Asynchronous Care in Healthcare by Fadil Ghazi. Hello and welcome. Today we are diving into an exciting and transformative aspect of modern healthcare, asynchronous care. Imagine connecting with your healthcare provider at your convenience without the hassle of aligning schedules. That's the promise of asynchronous care. Over the next few minutes, we'll explore what it is, its benefits, real-world applications, the technology, and some of the challenges to consider. What is asynchronous care? Let's begin with the basics. Asynchronous care refers to a communication between patient and healthcare providers that doesn't happen in real time. For example, a patient uses a mobile app to report symptoms and upload photos or test results. A doctor reviews this information later and sends back a diagnosis, treatment plan, or follow-up instructions. This mode of care is ideal for non-urgent medical concerns and is powered by tools like secure messaging platforms, patient portals, and remote monitoring devices. It's not meant to replace in-person visits or live consultations, but works as a complementary approach to healthcare delivery. Applications of asynchronous care. How is asynchronous care used in real life? Let's look at some examples. Chronic disease management. Patients with conditions like diabetes or hypertension can share their vitals such as blood sugar levels or blood pressure readings through remote monitoring devices. Providers review this data and adjust treatment plans accordingly. Mental health assessment. Patients can complete questionnaire or share concerns via secure messaging. Therapists or psychiatrists review the inputs and provide tailored advice or prescribed medications. Post-surgical follow-ups. Instead of in-person visits, patient can report healing progress by sharing photos of surgical sites or filling out symptoms checklist. Providers can assess recovery remotely. Prescription refills. Need a routine medication refill? Asynchronous platforms allows patient to submit requests which providers can approve without requiring a physical appointment. Dermatology consultations. Patients upload images of skin conditions and dermatologist responds with a diagnosis of treatment options. Triage and screening. Before scheduling an in-person visit, patients can answer screening questions, helping providers determine the urgency of care. What are the benefits of asynchronous care? Accessibility. It bridges gaps for patients in rural or underserved areas. No need to travel miles for a consultation. Efficiency. It reduces wait times and allows healthcare providers to handle more care efficiently. Cost savings. By cutting down on unnecessary visits, it lowers costs for both patients and providers. Convenience. Patients can reach out anytime, anywhere without being limited by clinical hours. Technology enabling asynchronous care. Asynchronous care depends on a robust digital infrastructure. Let's look at the technology that makes it possible. Patient portals, securing online platforms where patients can access their medical records, communicate with providers, and upload test results or photos. Mobile health applications. Apps tailored for specific conditions or general health tracking allows patients to log symptoms, track vitals, and receive guidance. The remote monitoring devices. Devices like glucose monitors, blood pressure cuffs, or wearable trackers provide real-time data that healthcare providers can review remotely. Secure messaging systems. Platforms compliant with privacy regulations like HIPAA enable confidential communication between patients and providers. Artificial intelligence. AI assists in triaging patient concerns, analyzing data, and offering preliminary insights to support decision-making. EHR, electronic health records. EHRs integrate asynchronous interactions with a patient's medical history, ensuring continuity of care. Video and image analysis tools. High-quality imaging tools allow providers to review photos or videos submitted by patients for dermatology, wound care, or physical therapy assessments. Challenges and limitations. Despite its advantages, asynchronous care isn't without challenges. Not for emergencies. Immediate issues like chest pain or severe injuries still require in-person or real-time care. Data security. Protecting sensitive patient information is critical and breaches can undermine trust. provider workload. Without proper management, an influx of asynchronous cases can overwhelm healthcare providers. Technology access. Not all patients have access to smartphones, reliable internet, or the skills to use these tools effectively. The future of asynchronous care is bright. Advancements in AI, machine learning, and predictive analytics will make this model even more efficient and personalized. By complementing traditional care methods, asynchronous care supports the broader shift towards value-based care, where focus is on achieving better outcomes for patients at lower costs. To sum up, asynchronous care is revolutionizing healthcare by offering flexibility, efficiency, and broader access to care. From managing chronic conditions to streamlining follow-ups, it's a game changer for patients and providers alike. Thank you.